Hello, everyone. My name is Ellen. I am a research coordinator at the Center for Leadership and Disability. Thank you for having me today to speak on one of Georgia's many issues that individuals with disabilities face. Today, we'll be focusing on dental care challenges. Here's a quick overview of what I'll be going over in this presentation. First, some background information on the Center for Leadership and Disability, as well as the CDC statewide Disability and Health Program. Then we'll move into the needs assessment and the findings from said assessment. Finally, we'll briefly go over the Disability and Health Linkage Program. Let's get started. What is a CLD? If you're unfamiliar with the Center for Leadership and Disability, we are the University Center for Excellence in Developmental Disabilities at Georgia State University under the School of Public Health. Our mission is to translate research into sustainable community practices that contribute to independent, self-determined, inclusive, and productive lives for people with disabilities and their families. Now on to the CDC Disability and Health State Program. The CDC's Disability and Health Promotion Branch currently funds 10 state disability and health programs, with Georgia being a new awardee under a cooperative agreement. Some of the other states include Missouri, Utah, Michigan, New York, among others. The program will take place over a 5-year project period. It started in 2021 and will be going through July of 2026. The overall goal of funding this opportunity is to reduce health disparities experienced by adults with intellectual and developmental disabilities and adults with mobility limitations in the United States. Much like many of our projects, a needs assessment needed to take place. The goal of the statewide needs assessment is to describe disparities for adults with IDD and ML in Georgia, some of which related to the receipt of recommended accessible preventive healthcare to address outcomes, engagement in health behaviors, and barriers within Georgia. People with intellectual and developmental disabilities and mobility limitations are at a greater risk for poor health outcomes, particularly in adulthood. Dental care was identified as a gap in year 1. Preventive dental care is not provided as part of Medicaid coverage in Georgia, and both Medicaid and Medicare coverage of dental procedures is limited to emergencies only. Further, despite poor dental care being associated with negative health outcomes, dental insurance and coverage is hard to obtain, and it is reported to be difficult to find a provider who accepts adult patients with IDD. The primary focus of the needs assessment of dental care among adult patients with intellectual developmental disabilities included these guiding questions. Number 1, what types of dental diagnosis and procedures are occurring in ambulatory care settings in Georgia? 2, where are dental emergencies and care associated with dental problems occurring in the state of Georgia among people with IDD? 3, what are the costs of dental emergencies among people with IDD in Georgia? And what are available resources that exist to support dental care in Georgia, as well as what proportion of community dental providers accept adult patients with IDD in the state of Georgia? And here are our findings. The second most common diagnosis was gingivitis and periodontal diseases, and that's about 28%. A significantly higher proportion of adults with IDD visited ambulatory surgery centers for a primary diagnosis of dental problems than adults without IDD. The comparison is 8% of adults with IDD visited these ambulatory surgery centers compared to 0.2%. 76% of adults with ID visited ambulatory care center for dental caries, also known as cavities. But what we can see here is that 100% of these were elective non-emergency, that with the proper preventive care, patients could have avoided going to the ambulatory surgery centers. Now, median cost for adults with ID seeking dental help at an ambulatory care center was significantly higher than those without ID. Patients with ID paid on average approximately 4 times higher than the median cost for adults without ID. So we're looking at $21,000, around $21,000 for patients with ID compared to patients who have no IDD. They paid around $4,000. All right, and here's some regional data. The following health districts were most likely to have adults with IDD that had a visit to an ambulatory surgical setting for dental problems. These counties include Cobb, Douglas, DeKalb, Coastal, and North Central. To address guiding questions 4 and 5, we implemented a secret shopper study, which involves calling providers with a scripted series of questions seeking to obtain information about care for a hypothetical youth with IDD. And here's what we got. More than 80% of dental care providers indicated they would treat an individual with IDD and that they would be willing to treat both children and adults. Unfortunately, the majority of providers were unwilling to accept patients with Medicaid. 84% indicated they would not accept a Medicaid patient. And among those who said they would take a Medicaid patient, there were frequent caveats to that. For example, they would only take patients that were 13 or younger with Medicaid, or only take supplemental Humana Medicaid plans. Among those who would not treat an individual with IDD, when we asked, less than 50% had a provider in mind that they would refer the hypothetical parent to who their child could be treated. The primary needs assessment analysis so far is from Cobb Douglas County, and it suggested that providers are willing to treat individuals with IDD, but that providers are not able or willing to take Medicaid for payment. Further additional education of providers about other clinics who are able to treat patients with IDD is warranted. Our next steps include identifying how to support adequate coverage of preventive health dental care services to incentivize Medicaid acceptance. For example, it could be through increasing reimbursement rates or identify supplemental funding that would cover the cost of such services out of pocket. The secret shopper study will continue to go into year 3 to gather additional information from other health districts. So hopefully we can have some updated data numbers at the end of our year 3. We talked about financial accessibility being a challenge for patients. Patients with disabilities may face additional costs for necessary equipment or additional appointment time. Other barriers to keep in mind is physical accessibility. Many clinics are not wheelchair accessible or lack proper equipment for patients with mobility impairments. There's also communication accessibility. Patients with hearing or speech disabilities may struggle to communicate with dental professionals who do not provide proper communication aids. And then there's transportation. Transportation can be a challenge, especially for those with mobility issues or those who live in rural areas. Part of the CDC statewide disability and health project is implementing the Linkage program. This program is focused on connecting adults with disabilities to accessible, community-based health care services, providers, and resources. The role of the Linkage coordinator, that would be me, is to help our participants gain autonomy over their health and healthcare decisions by educating them on the best health practices and providing assistance in finding accessible providers for their specific needs. It is very similar to a closed-loop referral system. The Linkage coordinator holds an initial session with the participant. Participants will complete a screening where they talk about general health topics and the last time the participant attended a doctor's appointment. The session can last anywhere from 45 minutes to an hour and a half, depending on the time needed by the participant. After the session, the participant and Linkage coordinator identify any unmet health needs and connect them with accessible community-based providers. And I get it, labeling a provider as accessible can be challenging, as what is accessible for one person may not be accessible for another. However, we try to connect or link participants with providers who have disability competent care, training, exposure, or recommended by the disability community. Linkage coordinators encourage participants to schedule appointments or enroll in the recommended programs based on their goals and areas of unmet health needs. Although if needed or requested, Linkage coordinators can assist with this as well. 3 months after the initial session, the Linkage coordinator meets with the participant again to determine if the participant connected with the referrals. They also check in throughout the 3 months to encourage, answer questions, and address any barriers before rather than during the 3-month follow-up. Participants receive an Amazon gift card after completing the initial session and another one after the 3-month follow-up session as a thank you for their time and participation in this program. Here are some linkages we can do. Anything that may affect a person's physical, mental, or emotional well-being can be something we make a referral for. Healthcare referrals we've provided include, but are not limited to, looking for a primary care provider, eye care, mental health, and assistive technology. Non-healthcare services that participants have wanted help finding include food banks and farmers markets, as well as independent living services, employment assistance, and wellness and social groups or classes. In order to be eligible for participation, participants must be 18 years or older, live in the state of Georgia, and have an intellectual or developmental disability diagnosis. And we've come to the end of this presentation. So just to recap, this program is designed to assist adults with IDD in finding the care and resources they need regardless of their waiver and/or coverage status. This program is completely free and completed on a volunteer basis. If you're interested or have additional questions, we can schedule a quick call to talk more about the Linkage program. Or if you know anyone or would like to share our Linkage flyer to your network, feel free to do so as well. Thank you.